Oh, here we go. Perfect.
Perfect. It is there. Let me move this bar. Okay. All right. So this is the staff report. This is year to date for January through March. Our headcount is 264 employees. Since the beginning of the year, we have hired 10 employees and we have separated 9 employees. And some of those, again, are due to retirement or other reasons. The growth rate is 0.4%. The turnover rate is 3.4%. Average tenure on all of our employees are 7.9. We're gonna see the numbers for last year's comparing to this current one. So total regular full-time employees, we have 120 employees, which that's 45.5% of our total headcount. Union employees, we have 82 union employees, and those are also full-time employees. Part-time on-call employees, we have 54 total part-time on-call employees, and those are lifeguards or range workers that go work in the golf course. The regular part-times, we have 6 regular part-times and 2 seasonal employees. So you can see the little pie chart there, yes.
Who are the 2 seasonal and what do they do?
So they are lifeguards. They are lifeguards. They normally come, they're not just part-time on call. Most of the time, part-time on call, they work less than 19 hours in a week.
Okay.
And that's the rule. They don't get benefits. They only get their sick time. Regular seasonal employee or regular part-time employee, they will get specific amount of hours each week so they can work more than 19 hours. That's why sometimes we have to make the distinction there. And that's the little pie chart so you can see the difference or how the number of employees are separated. Now comparing to last year, so this year we have so far 264, last year we had 260 employees. Again, from the beginning of January 2025 till the end of March 2025. Same, we hired 10 employees. We only separated 6 employees. You can see there that the average tenure is 8.4. So it's dropped this year has dropped compared to this number, dropped by 0.5%, right now it's 7.9.
That's probably when you have long-term employees who retire, they're older.
And are ready to retire, that's what's driving this number to be lower now. Same, we're almost there comparing to the current year, 125 full-time employees, 80 union members compared to 84 right now. Part-time on call 44, regular part-time 8, and we had more seasonal employees last year.
Let me ask the question on the seasonal lifeguards.
Yeah.
We had 3, now we have 2. Is that why we have the times when the pools are open without lifeguards?
Sometimes, yes, we need to fill those positions to be able to cover all of the pools.
But the fact that we do open the pools now without lifeguards, that's allowed us to just have 2 on staff instead of 3?
Well, we would like to have more than 2. Recruitment of lifeguards is an ongoing challenge, as you know.
Yeah, I've heard that.
Yeah, we're still recruiting.
Yeah, this is the time when they start to kind of come back from college or look for summer positions. So I just signed one the other day. So I think we'll see that pick up a little bit, but we definitely need more in order to maintain the hours.
Yeah. Summer is our best time to get them.
Correct. Yeah. And then the last chart under staff report, you can see the generation graph in there. So you can see 2026 here and all the way down to 2022. So I'm going to start from here. You can see the difference there now, how baby boomers, it's behind the yellow when it's blue, white. That's why the color doesn't show it there. But you can see baby boomers. At that time, we had 74 in 2022, and it's been dropping now to 44. So we are having less baby boomers, but then Generation X is increasing now. So we're starting with 80. We started with 80 in 2022, and you can see how this has been increasing. And as of 2026, we have 102 employees that fall under that range on Generation X. And millennials and Generation Z, so they're pretty steady compared to last year's, yeah. Yeah, we see the trends changing when it's Generation X and baby boomers. And that's pretty much on the staff report. Do you have any questions?
No.
No?
Looks good.
Perfect.
Okay. So, we don't have any unfinished business. So we'll go ahead to new business and the Kaiser report.
Right. So I had a meeting with our brokers last Friday and also with Kaiser, our executive manager from Kaiser. So they provided us with some information on Kaiser utilization on the medical plans. So that's the agenda. And then you can see here now on the next one. We're gonna try to make it a little bigger. Is that good? Okay. So you can see there, this is our demographics for our group only. It says subscribers, we have 95 employees that have signed up for Kaiser medical plan. And then it says members 183. What's the difference between those two numbers? So we have 95 employees that have subscribed for benefit, but they have added their dependents, either their children or their spouse. So that adds up to a total of 183 members.
So that includes the 95 subscribers?
95,
Okay.
correct,
Okay.
yes. Then you can see now the average subscriber age is 52.7. On the second column, this is for our group, the second column shows the regional average, which is 41.8, and ours is 52.7. So we are higher than the on age by compared to the regional. And the comparison again, it says they're 10.90 years older. Then with the industry, overall, Kaiser, it's 43.4 years.
So just a quick question, does the fact that our average subscriber age is older than their averages,
Yes.
does that affect our cost?
It depends. It's not just the age, but also members are, it is, again, it's not just our employees, but it's also all members, not just the subscribers. But it depends on if, it includes everyone, right? Because I can have my spouse that can be older than me that maybe needs more medical attention as well. So that number will be a little bit higher. So it's not just our members' ages, but the total, I mean, sorry, not just the subscribers, but all the members' ages in there.
Okay.
So if they have kids,
So
it brings it down.
Bring it down, correct.
Parents, it brings
The
it up.
members are 44, okay, I get it, the difference, okay.
But I see that even with our subscribers, that number is gonna keep going down.
Yeah, it should go
Since we have
Our
people that
age.
are also retiring,
So we have like-
correct? And there will be new generations, yeah. So the average member age, yeah, and then you can see it now there, the average member age is 44.1.
Okay.
Right, compared to the regional average, which is 35.4, but then you can see still there is a difference comparing with a region
Yeah.
by 8.7 years difference, right?
That's
And the
interesting.
industry is at 37, which is higher than the regional average as well. Also gender, as percentage of females is 51.9% of our group compared to the region, which is 50.6%. So we're doing pretty good there. Average family size, so 1.9, let's say 2 members. The other one in the region is 1.7, 1 member, and close to 2 members as well. Enrollment stability index, our enrollment is pretty good. We have 94% of all members that qualify for benefit that have enrolled in benefits. Compared to the region, which is at 90.4%. And the industry is 87.7%. We have more members, I mean, more employees enrolling in our benefits, including their dependents as well.
Wasn't that one of the reasons that we tend to stay with Kaiser for
Correct.
so many of the people?
Yes.
That's their place.
That's their place. yeah.
Yep, that is correct.
And they don't want to change doctors and change, yeah, I don't blame them.
The next one. So this is the engagement overview. This is getting connected, knowing your numbers, staying up to date, seeking care, and improving health. The first three columns, I'm not gonna go through all that in details. I'm gonna focus more on the last three because this is only for, let's say, employees that have been in our plan for a month, 2 months, 3 months, it's less than a year.
Right,
So those numbers I can't compare much with the region or the industry.
right.
So you can see under getting connected, our group is at 91.2%, which means it's registering and signing to the KP.org application or app so they can do anything that is needed. The region is at 86.6% and the industry is at 74.7%. So meaning that our group is pretty involved when
Right,
it
that's
comes to
good.
their,
Well, they're all
getting to know
good.
their health, yes. Knowing your numbers, which is your body mass index, BMI, blood pressure, exercise as a vital sign. Our group is at 87.1% engagement compared to the region at 84 or the industry at 82. So we're doing pretty good there as well. Staying up to date, cancer screening, flu shots, cholesterol, glucose. We're at 87.1%, the region is 86.4%, and the industry is at 81. Again, we are doing pretty good there. Seeking care, outpatient visits, nurse advice, secure messaging, filling prescriptions. We're at 92.5%, so we're more than 90% compared to the industry and the region, which is at 80 plus. Improving health, so our members are improving at 2.7% compared to the region on the total industry. And you can, the statement here says employee engagement starts with registering to the kp.org. When employees register, they can access a variety of services to help them take care of their health without leaving the office. So each in-person appointment your employee don't need saves you an average of saves us $180 in direct costs. So
Those are Kaiser costs, the
Correct.
158? Wow.
that we save for like a visit to the doctor. I mean, just to go to the doctor, aside from your copay and all that, can range from 158, 160.
Yeah,
Or you can just do online or phone call, which they won't charge you to tell you the same thing if you go in person.
that's good. People are taking advantage of their health,
Yeah.
their health insurance. It's good.
And is the regional, what is the region? Northern California, or when they define, how do they define?
North
the
California,
region?
Northern California is a region, correct. And then the industry covers most of California and some other areas, not all the states, outside the state. However, our employees, let's say if they're out of state, they would be able to seek medical treatment if they're out of state. They will have to pay out of pocket and then they will have to submit for a reimbursement.
Yeah.
Mhm. Let me see if I can make this one a little bigger. Oops. So this is just the kp.org activity. The orange, the dark orange color there, that's numbers from Q4 in 2024. The one below is up to Q4 in 2025, so we can compare those numbers. And then the regional, it's the light gray, and the other one is the dark gray color for the total industry. You can see that online prescriptions and refills, so more members are actually doing it through the application. You can see the change in 2024, they were doing like 1,135 prescriptions. Compared to 2025, they were doing more prescriptions at 3,385. So that's a change on 22%. So employees are utilizing more the kp.org app.
They charge you. I mean, it's cheaper if you get them by mail.
You can do by mail as well.
There's a big incentive now to get them by
Mhm.
mail.
Yep.
And not only that, but it's so much easier than having to go wait in the
Yeah.
cars.
You don't have to park.
Yep.
That's right, you don't have to park.
And then you can see compared to those, the region and the industry, those gray colors. So we're doing much better than them.
Right, yeah.
We're more involved. Members are more engaged there. The only one that is pretty close, dropped by close to 1%, it's the unique members view lab results. Sometimes they just don't go to the app to see the results. They like to go to the clinic or the hospital to get those results and they are not easy to read. You need somebody to
Yeah, you
like
have to
explain
know.
that to you. Yeah.
So can I just share a personal detail? I don't mean to get too personal, but I had an X-ray yesterday and I came home and it was there. It was in my email, the results of this
Yeah.
X-ray. And I didn't know what they were talking about. And they said, they gave me this question about preference. Do you want to get your X-ray results immediately or do you want to get them when your doctors looked at them?
Mhm.
So I chose when the doctors looked at them because, you look at those things, you're like,
Yeah.
oh God, that's, yeah, I don't know, is it good? Is that good or bad? Yeah. It was just yesterday this happened, so
Yeah,
they're really
that's-
pushing
Yep, that's
some of
what's
that
happening.
feedback.
Okay, let me see
I like to get
next.
them first.
Oh, you do?
Yeah, but I have a little bit more background.
Oh, okay.
So with Kaiser, it says on mental health, it says our members are 5 times as likely to be screened for depression and 2 times as likely to respond to the treatment. So meaning out of those 5 members seeking for help, 2 of them responded to the treatment. Screening through Kaiser, we surpassed national screening rates across key cancer types like breast cancer, cervical cancer, and colorectal cancer screening. 3 out of 4 members when it comes to high blood pressure. So high blood pressure is under control for 3 out of 4 members for the above national average. It's just some data that they like to share with us. And health snapshot again. So we have 95 subscribers, meaning our employees, total members 183. The average age between the 2 of them is 44 years. Gender female 51%. Enrollment stability index is at 94%, which is really good. Percentage who saw a clinician is 84%. Blood pressure screening is at 73%.
That's good.
So they're using the system.
They're using the system, yeah.
This is another health snapshot that I want to share with you, smoking and weight. Of course, this will drive as well costs, right? And it's also Kaiser pays attention to the health of how healthy the member is.
Right.
They may find if the member is overweight or they have record of smoking. So you can see the numbers there, overweight or obese. Our group Q3 was, this is just numbers from Q3 in 2024. We're at 79% and it dropped in 2025 to 77%. The region, it's at 72% and the industry is at 75%. We're still a little bit higher than the region and the industry there.
But not a lot.
It's, yeah. But that's on the overweight. And then on the smoking, we're doing way better than the region and the industry. Yeah. We were at 6%, we dropped to 5% last year. So, and then the industry is at 7% and 8%, 8% the industry and 7% the region.
Well, think about that with the smoking, you can't, you just can't smoke anywhere.
Yeah, exactly. And
The
this
smokers have to really find a place to smoke here.
Yeah, and this does include vaping and the e-cigarettes, so all that is in there.
Are residents or employees allowed to smoke on the golf course?
The golf course, no.
I'm hoping not.
Yeah. Okay, let's see what else I have here. This is just the prevention index, so it means that it costs nearly 3 times as much to treat colorectal cancer when it's caught at a later stage instead of an early stage. For people with diabetes, lifestyle intervention may decrease the risk of diabetes by 20%. So these are our numbers compared to the region and the industry as well. Male and female, you can see the difference there. This is for members receiving age and gender specific tests and the screening. Male are 73%, it has gone up to 82%. Female is 80%, it has gone up to 85%, which means that they are checking themselves more now compared to the industry and the region as well. Which includes blood pressure, cholesterol, cervical, breast cancer, so all those different tests or screenings that our members are utilizing right
The
now.
women are doing much better.
Yes, yep, at 85, I'm better than than the industry and the region. And what else here? These are some of the recommendations that Kaiser shares with our members. So they do provide some classes online, or they even provide like adult exercise, like fitness offering, healthy recipes. You can even register for the Mindful Mondays. There's a webcast webinar for blood pressure. Again, they provide some healthy recipes for our members, so you can attend those webinars as well. The prediabetes and diabetes basics, they do provide sessions as well, and there are some additional resources that they do provide as well for our members. There are different apps that they are free of charge for our members. Like one of them is, I believe it is called Calm. You can utilize that and it helps you with specific things. And they do also have another app where they can contact a counselor. They can just send their questions via text message to the counselor and the counselor will reply. And that's it.
That's very interesting to me, all the things that are provided in addition to what you think of as health insurance.
Yeah, that's right. Well, and it's all a part of keeping you healthy so that you don't use their system.
Prevent those
Yeah.
visits, they're trying to prevent those medical visits.
That's exactly right.
It's also makes it possible for people to stay with Kaiser, not only when they're employed, but then when they retire.
That's right. That's right. And especially Kaiser's very, very strong in Northern California.
Yeah,
In Southern California.
and
Not nearly as much in Southern California, really.
Yeah, and I did bring up the question that we discussed in previous meetings to our broker about what about if we change from Kaiser to a different medical provider? That's something that can happen, but I mean, we can lose Kaiser completely if we want to have two different vendors, let's say Kaiser and Aetna, United Healthcare. They do require certain percentage from our members to subscribe to their plan.
Oh.
And Kaiser does require also a certain percentage of members to be part of the plan, otherwise they won't be part of our plan. And then we'll lose that as well. And I may say, oh, I need at least 60% of your population to be part of our plan, to have two different, to share services with another service provider. So, and that may, if we decide to go a different route, if we lose Kaiser, we lose our grandfather plan as well, and services may change as well. So there's a lot of different factors that consider before if we decide to like make some changes or add different programs or
Do
plans.
you get requests from employees to have a different health plan?
Not directly to me. I have not heard anything lately or
It seems
since I've
like
been
from the
here.
usage and everything that
They're using
people
it.
are very happy with it. They're using it,
yeah.
and they're using it properly.
And we do have, if they're worried about like how much they're gonna be paying to cover or their premiums coming out of the employee's pocket, we do have two different plans. We have the HMO and the high deductible plan. If you're someone that do not visit the doctor too often, so it's best for you to go with the high deductible plan.
Right.
And we do offer the health spending account as well, that employer funds for their employees. there are options there still.
Right, that's good.
Yep.
So I know we have a different workers' comp plan, but what happens if one of these employees has an injury and goes to Kaiser and it's a, and it's a workers' comp injury?
With the workers' comp injury, right now, our insurance carrier is CNA, and we do have a relationship with Concentra. So Concentra is our go-to place,
Oh.
clinic for all injuries that happen at work. So we've been with them already since 2023, if I'm not wrong, with Concentra. And it's been going fine. It's been good.
So is that located?
There's one in Walnut Creek, there's another one in Concord,
Oh,
there's other
okay.
in other areas as well. And that's for if injuries happen within business hours.
Yeah.
Let's say if it happens over the weekend when, let's say, HR is not here or not here, to direct them to Concentra, we do have John Muir, so we can send them there after hours or on weekends. And that's where they will get their medical treatment, if required. But before doing all that or sending our employees to the clinic or the doctor to seek medical treatment, we do have a program with CNA. We have a vendor called Genex. We have our employees contact, if it is not like a life-threatening or like a 911 call that we have to do, we definitely call 911 if it is an urgent thing. So we have them contact Genex, and then they will do an intake. They will speak with a registered nurse, and then they will be the ones either providing some self-care advice, or they will say, no, you need to go see a doctor right now. I'm gonna schedule you, and then they send them to the clinic right away. Because we are not doctors. I cannot tell, oh yeah, maybe you need to go see the doctor. Oh no, you can take care of yourself. We need the experts, so they will be the ones deciding if they need medical treatment or not, or if it is just self-care. Like, oh, you have a wound, maybe just ice it or something like that. We had an employee that was bit by a tick on the left side of his rib, so we had to send him to the actual clinic for that tick to be removed because they keep making their way in.
Yeah.
So things like that, so we have to address that ASAP.
And when do we think we're gonna get the estimated cost for next year?
So we will get that by June.
Okay. Oh.
Yeah, so we will have it ready by July.
And typically, it's always been estimated much higher than it finally comes in.
Yep.
Right.
Like that's what we estimated last year, but then we ended up only increasing by 4.3% or 4.1%.
Yeah. Well, and if our employees continue to utilize the system properly, that bodes well
Yep.
for our cost.
Yep.
Well, if they use it a lot,
No, I mean,
yeah.
if they use it appropriately, meaning that they use the website, that they go,
Right,
that
yeah,
they
no.
do the preventative things and all of that.
Yeah.
No, I didn't mean that they overutilize it. I mean, if they use it correctly.
Yeah.
That they take care of their health.
Yep, so that's pretty much it from today's meeting.
Great, that's really interesting.
It is,
It is, it's very interesting how it works. Okay, well, we don't have any other new business, I think, so the next meeting will be May 13th.
Which has been canceled.
Which has been, oh, that's right, it's canceled, that's right, oh, that's right, it's canceled because we wouldn't have a quorum.
Correct.
That's right, it would just be you.
Oh. Yeah, well, I don't need
That's
that.
right. No quorum,
Okay.
that's right. So no meeting in May, so it's June, it'll be June.
It's gonna be in June, and that's when I will be presenting also, we'll be discussing if we're gonna stick with the April CPI number, or we will use the one in June, which comes up not until July,
It's
mid-July.
gonna be interesting to see that number.
It will be.
Yeah, the number from April doesn't come up until May 12th. So I will know what that percentage increase is on May
I
12th.
wanted to tell you, I think the reports you've done have been both interesting, informative, and useful.
Yeah,
So thank you very much.
Yes, no, thank you,
Good job.
thank you.
You had to come in, you came in like a lion. That's
And I
So
thank you for the
somebody's gonna
support
be
as
here
well.
on June
Yeah.
10th, right?
Somebody's gonna be here on June 10th.
Yeah, there'll be
Okay.
new members, there'll be new
Right.
members.
Jeff will be here.
Jeff. China will be here. with me.
China will be here. Arnold
No,
will
I
be
think
here.
it would be, thinking that, it would probably be good for me to stay on here, because at least
Yes,
I've
you
had
have-
1 year.
Oh,
Because
absolutely.
you guys will be gone, there's gonna be no history here at all.
That's right. No, you should stay on.
All right, we'll see. Okay.
Okay.
I want to take a moment just to thank you, Carol and Mary, for being part of the compensation committee and for all the support and feedback that I always get from you guys.
Well, it's
You
been
guys will be
great.
missed.
It's been great working with
Yes,
you,
totally.
and it really, it's such an interesting committee. This is my 3rd year on it. I really enjoyed it,
Yes.
so.
Well,
Anyway,
I think the fact the report you give, I feel like I understand who's working here and to some extent why they're working here, because it works for
yeah,
them.
that's right. Yeah, that's right. And keep doing those employee
Yeah.
things
Events,
like,
all
I
that.
really think that employees love those breakfasts and lunch and
Definitely.
holiday party and all of that.
The fun thing it is, because, many of us have been here a while, they know you. I mean, it's not a distant thing, they know you.
Yeah, that's right.
Yeah.
It's great. And then the more you go to, the more we go, the more of them we know.
We know.
Yeah.
No, definitely.
It's
Well, you're
wonderful.
more than welcome to keep joining those events.
Okay, all right.
All right.
Anything else? Then
That's
we
good.
will
Wow.
be adjourned at 1:34.
Wow, thanks, Carol. Have the
Oh,
afternoon to
boy,
ourselves.
we have the afternoon.
Yeah,
free.
okay.
Thank you, China.
Thank you, John.